What does informed consent for buspirone look like? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications and how I would go through the informed consent process as I would with one of my patients. And so today we're talking about buspirone. Now, buspirone, otherwise known as Buspar, is an anxiety medication. It also acts on serotonin, but it acts on different receptors than our SRIs or SNRIs. And so it has a slightly different mechanism and can generally be used safely in conjunction with an antidepressant. Of course, like we've talked about with serotonin syndrome, it is going to increase your serotonin load, so that's important to keep in mind. Usually this medication is going to be dosed at least twice a day, sometimes 3 times a day, and so this can be tricky for people who have trouble keeping track of taking medication. We usually think of this medication as very well tolerated. Some uncommon side effects include things like headaches, stomach upset, dizziness. Sometimes people can feel fatigued or drowsy, and other times it can cause difficulty with falling asleep. Very occasionally sweating or clamminess, sometimes blurred vision. There can be diarrhea and nausea in addition to stomach upset, occasionally muscle cramps or numbness and tingling. Most of these side effects I don't hear patients complaining of. Usually, if anything, it might be the headache or the upset stomach. Now, very rarely, there can be movement disorders, things like shaking or uncontrolled muscle movements, and sometimes people can experience an effect on their mood, so they might feel more depressed, or they might have really negative thoughts. I generally tell patients that this is a really well-tolerated medication. However, if you've had a different experience with this medication, I would love to hear about it, so please put it in the comments below. Generally, I don't think of buspirone as a really powerful medication, so I think of it as a kind of low-risk, low-reward potential medication. So I'll go over that with my patient, and we'll decide whether or not it makes sense for them. I'm also putting together an email list so that I can have more direct communication with those who are interested in my content. I'm not going to spam you, but I may have future offerings or things that I want to be able to communicate about. So if you're interested, then send me a DM with your email and I'll add it to the list. Wishing you all good mental health, and I'll see you in the next one.